early exchange, shaping policy, advancing development.
Diaspora, a powerhouse with a large dose of knowledge, skill, competence, and experience for transformation of the Nigerian healthcare system. You need to deploy such a powerhouse. Good afternoon, ladies and gentlemen, special guests and guests. Douglas Emeka Okor is my name. Brain surgeon and an individual who is extremely passionate about progressive and positive change in the Nigerian healthcare system. Next slide, please. So today, I'm going to be talking about a global perspective in transforming healthcare in Nigeria. But actually, my focus is going to be on the Nigerian diaspora. I want to actually talk to you guys. Now, I say, let's think right, act right, and spend right.
That was Dr. Douglas Emeka Okor, who is a consultant neurosurgeon. He is a Nigerian doctor, both practicing in the diaspora, talking about the Nigerian diaspora contribution to the health sector. He joins virtually this morning from the U.S. Good morning, Dr. Douglas.
Thank you very much, SOUQ News, and thank you very much, Blessing, for having me. Just to correct an impression there, yes, I do work in the UK, but I'm actually based in Nigeria, in Abuja. So I'm based in Nigeria, so I straddle both places. But thank you for having me.
It's good to see that you walk your talk. Having talked about the role of the Nigerian diaspora in the health sector, you're walking the talk by making personal contributions here. All right, let's look at the health sector in Nigeria, what it is today. We've seen doctors leave Nigeria in search of greener pastures. Now, at one time, it was said it was a doctor to about 1,000 patients in Nigeria. But with the Jackpot syndrome, I don't know what that is right now. Maybe you could tell us exactly. So what is your assessment of the health sector in Nigeria currently?
So, Blessing, like I've always said, the Nigerian sector in Nigeria has struggled for a very long time when it comes to the issue of availability, accessibility, and affordability of care, especially the basic health care for the multitude of Nigerians. Remember that figure from the National Bureau of Statistics, where you have 133 million multidimensionally poor Nigerians. Those dimensions are about basic access to basic healthcare, hygiene, and basic education. So we have struggled for a very long time. Only recently, maybe in the last 10, 15 years, there have been significant improvements in the delivery of complex care. Okay, so things like tertiary care, where you actually provide complex brain and spine surgery care, things like kidney transplants, heart surgeries and stuff, but they are more and significantly more in the private sector. But overall, when you look at the specific indices and how things are playing out in the healthcare system in Nigeria, we are struggling.
Struggling. Now, why is there a struggle? Does it have to do with manpower or equipment? What are the issues?
So the issues, if you want to dive look at the issues, you're looking at specifically the components of what make a healthcare system, all the way from institutions and governance to funding and finance to the health workforce, or what we call the human resource for health, to service delivery itself and things like medicines, consumables, and vaccines, all the way to how we actually use the digital platforms in terms of technology. So we are struggling in all those areas. So if you look at, for example, governance and institutions, we know that when we look at our federal government and our subnational, i.e. the state governments, that they've not really focused on healthcare. They've not really focused on really just on transforming our institutions in terms of governance, funding and finance. If you look at what we talk about with respect to the in 2001, when we had the Abuja Declaration, where we said we needed to be spending 15% of our budget on healthcare, we've never ever got into more than 6%. Okay, and of course, when you go to the human resource for health, we don't have the numbers. Those that we have on the ground in Nigeria, they don't have the requisite environment that will actually keep them in terms of how they work, the training and also the remuneration as well. So we have lots of issues within the healthcare space in Nigeria. And like I said, these are the components of healthcare that we've not really put our muscle and actually really worked on. And so that's why we are where we are today in Nigeria with respect to healthcare.
You have practiced outside of Nigeria and in Nigeria as well. What have you seen in the health sector in the UK that makes it very functional?
So all the components of healthcare I talked about, the healthcare system I've talked about now, they have actually prioritized healthcare, and they have funded and actually put in policies, programs, interventions, and implemented all these to the later. And also they have what I call, in terms of a philosophy, what I call the value for human life. It's a philosophy, okay? Now, we are struggling in Nigeria when it comes to actually having that sort of philosophy where we say, oh, we have the value for human life. And until we can actually change that around, things will not change in the area. So key thing, Blessing, okay? In places like UK, US, Australia, Canada, they have value for human life, and they have put in policies, programs, interventions, and implemented things in such a way that they actually understand that healthcare is a mainstream priority, okay? So they have actually put their muscle there. Remember, that's what they call the Sustainable Development Goals. There are actually 17 of them. Healthcare is number 3. This morning, you and your team and your guests were talking about education. Education is actually number 4. So in the Sustainable Development Goals, healthcare even comes before education. It is that important. You cannot develop as a nation without actually sorting out your healthcare system. Bless.
The healthcare sector is very broad. It's not just about hospitals where you have doctors and nurses. If you're talking about the healthcare sector, you also talk about the pharmaceutical sector, which provides support, because when doctors diagnose and they treat the right prescriptions, you need to get to the pharmacy to have that prescription. In recent times, we've seen the exit of pharmaceutical companies from Nigeria, making certain medications very, very expensive. Now, you're talking about the role of Nigerian diaspora in the Nigerian health sector. Are there certain expectations that you have from the Nigerians in diaspora to bridge some of the gap that the health sector currently has? One of them, maybe in the area of the pharmaceutical industry.
Well, so Blessing, you're bringing up the pharmaceutical industry, but I'm going to actually go wider than that, okay? And one of the key things I said in one of the presentations I gave recently when I was the keynote speaker in the Association of Nigerian Doctors in the UK was that the diaspora needs to engage within the Nigerian system, and that they will play a significant role in transforming healthcare in Nigeria. So the first key reason is that why should they even engage? Why should the Nigerian diaspora engage in the first place? The first reason is that they have a massive amount of this thing that we call the knowledge, skill, competence, and experience, and that is needed. Number 2, no matter where a Nigerian is anywhere in the world, they are linked back to Nigeria, and they have family members in Nigeria, and anything that happens in Nigeria with respect to any sector in Nigeria will definitely impact and affect them. One of the questions I asked that particular pool of Nigerian diaspora when I was giving that presentation was, what are the 2 key things when we say, oh, when Nigeria happens to you, that you get worried about as diaspora? And all of them said it: security and healthcare, especially when it comes to emergency healthcare. Okay, so they need to actually get involved. The question is, how do they get involved? So they get involved either as individuals, as groups, either small or large groups, okay, as what I call multilateral partnerships that are cohesive. And I explain what I actually mean cohesive groups. And they will be engaging at institutional or facility level, at community level, at state level, or federal level. Now, how do I want this, especially when it comes to this cohesive group? When I say cohesive group, let me explain what I mean. You have the Nigerian doctors in the UK, in the US, in Canada, in Australia, in South Africa, for example. Imagine those different groups pulling together, okay? Imagine the Nigerian nurses in the UK, Canada, in all these countries we're talking about, pulling together, the physiotherapists, the medical lab scientists, the biomedical scientists, okay? All these different health professional groups actually pulling together and doing a couple of things: interrogating, contributing, and actually participating in government policies at both at federal and state level, government policies, programs, interventions. okay, it will make a significant difference because these are eggheads. These are very experienced and very competent and very skilled people, and you need them in Nigeria. Now, the question is, how do they actually contribute? If you look at one of the recent policies of the Federal Ministry of Health, where they talked about how they can actually stem immigration, it looked at in that almost 60-page document that they were talking about, one of the key things, bringing Nigerian healthcare professionals back to Nigeria. Blessing, in reality, that cannot happen in terms of the significant numbers that you want. If you want to bring Nigerians back to Nigeria, the outside the border, you will, within the next 10-15 years, you will not succeed in bringing up to 5% of them. So that shouldn't be the target. That whatever policy they bring should be one that can actually create an enabling environment down on the ground in Nigeria for the healthcare professionals in Nigeria to stay on the ground in Nigeria. So then the question will not be, Blessing, how are the healthcare diaspora, Nigerian healthcare diaspora, going to actually participate? Their key participation is going to be in support and training. Okay, support, training, mentoring, and also by investment in business opportunities within the healthcare space in Nigeria. And a couple of things that can happen. Number one, there's what I call the sector-specific remittance approach, sector-specific. So you can actually have, for example, in the UK, and of course you can extrapolate that to other countries, you can have the Nigerian Association of Nigerian Doctors, Nurses, and stuff like that with the Nigerian government actually negotiating with the UK government and say, hey, you can actually have a percentage of our national insurance and our income tax actually going to specific projects in Nigeria. For example, a project like actually training at the basic healthcare level for cadre of staff like the community health extension workers, the pharmacy technicians, and the medical lab technicians. Okay. Second thing, when it comes to complex healthcare, okay, whether you like it or not, Nigeria is actually moving in leaps and bounds when it comes to delivery of complex healthcare. And I'll give you an idea of what that complex healthcare, because there are Nigerian diaspora healthcare providers that have actually come back to Nigeria and have raised the bar significantly in terms of the quality and the safety of complex care in Nigeria. Okay, so where I'm going here with this lesson is about inbound medical tourism, where you now start having other people from other countries coming into Nigeria, and we can get there. Apart from the role that the diaspora is playing, these few of them that are coming back to Nigeria, the diaspora, the healthcare diaspora, and by expansion, the other Nigerian diaspora can actually play an ambassadorial role at some point in the future. When we start getting to that point where we're actually increasing the confidence of what we can do, especially within the private sector in Nigeria, it is the Nigerians abroad that will be telling the Ghanaians, the people from Cote d'Ivoire, your family in Cote d'Ivoire and in Ghana and in other Central African countries, you can actually go to Nigeria. They do complex brain surgery there. They do and the other stuff there and all that. Okay. Of course, one other thing in terms of getting FX into Nigeria is that you can actually have out of training exchange programs where you actually have people within the healthcare sector in UK, US, Canada, and stuff coming into Nigeria to come and have training for some specific things that they are not doing there anymore. Okay, in the UK, for example, when you look at things like doing myomectomies and doing some gynae surgeries, for example, they are not doing those kind of hands-on things in most of the developed economies. You can actually have people who actually train students coming to Nigeria and actually paying to actually come and get that training in Nigeria. So these are some of the couple of ways. So, like I said, in summary, okay, you need to have Nigerian diaspora coming in as individuals, as groups, either small or large groups, and this cohesive force of these multilateral partnerships coming to engage with government in such a way where they interrogate, very important, Blessing, they have to interrogate government policies and programs and stuff and ask the key questions, okay? You cannot have Nigerian government at federal and state level with all the issues that we have in Nigeria saying that, all of a sudden they have a light bulb moment and they want to repent and start doing well. They must have, somebody must put pressure on them. And so one of the key things I always tell the Nigerian diaspora is that you are privileged, okay? The 133 million multidimensionally poor Nigerians plus, because I'm sure that number significantly increased, they don't have a voice for themselves. You as a Nigerian diaspora can be a voice for them by interrogating, contributing, and actually getting involved and participating in government policies, programs, interventions, and actually implementing most of these things. Blessing.
You've talked about a number of things. Let me begin from the last that you mentioned, which is the Nigerian diaspora becoming a voice. Can they do this in isolation? I know that there are unions for health workers. How is the synergy, the collaboration between Nigerian diaspora and these unions?
So that's going to be very, very important, Blessing. And you actually brought up a very important issue. Now, the key thing is that, yes, I say that the Nigerian diaspora, they're going to play a significant role in transformation of any sector in Nigeria, and specifically in the health sector, which is really, really important. But of course, they're not going to do it in isolation. You already have groups, associations of healthcare providers on the ground in Nigeria. They will definitely work with them, okay? But one of the key things I'm saying is that we need a cohesive force. What I'm talking about is a situation where, for example, you have MANSA, the Medical Association of Nigerians across Great Britain. You have ANPA, the Association of Nigerian Physicians in the Americas. You have CANPAD, okay, which is the Canadian Association of Nigerian Physicians and Dentists, okay, and of course you have such associations and groups in Australia, in South Africa, in Germany, and all that. So we want these groups to pull together, sit down with the groups in Nigeria. And remember, I just talked about groups of doctors, but you also have groups of nurses, physiotherapists, medical lab scientists, or medical scientists. You have different range of groups, and I'm saying apart from the groups that are within a particular healthcare profession itself, you can actually have all these groups even coming together and actually working and actually brainstorming and actually interrogating what the government is doing, contributing to these policies that we talk about, and actually participating in the deployment of these policies in terms of interventions and implementation. That's really important. So summary is that, yes, we need these Nigerian diaspora groups. They are coming together and working with the groups in Nigeria. It's a no-brainer. They would definitely have to work with the groups in Nigeria. One of the key things that we're actually looking at is what we call the local way, which is thinking globally and acting locally. So clearly, we cannot move in terms of strategies of how to actually deploy things in the US and bring it hook, line, and sinker and deploy in Nigeria. No, in Nigeria, we have our own specific conditions and the cultural, the way we think and stuff like that. So one of the key things I always say is that to transform Nigeria, the transformation of Nigeria can only be done by Nigerians for Nigeria. Because one of the things I always say is that the Nigerian patients are worth it. We need the Nigerian diaspora in healthcare to actually understand that they will play a significant role and actually start engaging. Extremely important, because like I said, Blessing, the Nigerian patients are worth it.
Some of the services that you've mentioned that can be rendered by Nigerians in diaspora who are doctors or who are healthcare professionals, are they going to be pro bono services, or it's going to have a cost implication?
So one of the cases, there's this Maslow hierarchy of needs, okay? If you look at, as a human being, first of all, you need the basic stuff, isn't it? When you rise to the level where you've taken care of your basic stuff, especially for those in the diaspora, you start thinking about, oh, now I'm sorted as an individual. My family is sorted. I have my house, I have my car, I'm sorted. You start thinking of, oh, how can I actually contribute? And the first place that goes to it is actually your home country, where you did your basic medical training, and they actually contributed to who you are as an individual. Now, it's going to be multi-pronged. Okay, when it comes to the issue of revamping, reforming, or re-engineering the healthcare system in Nigeria, you have to think of it's a multi-pronged approach. Okay, clearly, in terms of the provision of especially complex healthcare in the private sector, it's going to be a struggle in terms of accessibility and affordability for the average Nigerian, those 133 million multidimensionally poor people, isn't it? But of course, there are many Nigerians that would like to actually volunteer. And I'll give you an example. In the UK, you have almost like 13,000 Nigerian doctors who were trained in Nigeria. In the US, about 5,000. In South Africa, about 5,000. And in Canada, about 1,000. I can tell you that out of all those people, at least you have about 10,000 doctors who are general practitioners or family medicine physicians. Okay, and in Nigeria, we have roughly about maybe 9,000 wards in the 774 local governments. Imagine establishing a policy or a program where you actually have volunteers who can actually provide remotely, based on digital platforms, remotely support these primary healthcare centers in each of the wards in Nigeria. That would be significant, because remember I talked about this issue of support and training. Imagine having this almost 10,000 Nigerian doctors who are general practitioners actually supporting in a in terms of the volunteer scheme, yes, and to actually help actually provide care at those levels. So those are some of the examples of how you can actually, yes, in terms of deploy different kind of interventions down the way, especially with respect to basic healthcare in Nigeria. Blessing.
Okay, Dr. Douglas, we're going to take a break. On the return, we'll look into some of the issues that you've raised, particularly the exchange programs. Let's take a break.
With 68 million cases of malaria reported annually in the country, an estimated 194,000 deaths are responsible for about 30% of the global burden of the disease. In today's news talk, we look at the necessity to rethink the programs of government on how to eliminate malaria in Nigeria and the whole of Africa. When a country carries this kind of burden, it is imperative for that country to acknowledge and indeed reject such an unviable record. And this can only be achieved through focused and sustainable actions that will ultimately bring the frightening statistics down. Shareholders have attributed the country's failure to tame the scourge to sufficient funds and commitment of government. If Nigerians can easily recollect any program designed to confront malaria, they will want to at least remember the African Summit on Rollback Malaria in Abuja, popularly known as Abuja Declaration Rollback Malaria Program, launched with fanfare in 2000. 24 years after, we hardly hear of the initiative, despite some successes that it has recorded, especially by the way of funding, both for domestic sources and international donors. It has gone the way of many other government agencies and initiatives in other sectors. As the saying goes, you cannot be doing the same thing the same way and expect a different result. If malaria is still as prevalent in the country today, despite various governments' efforts to eliminate or at least reduce it to the barest minimum in the last 70 years, then a rethink of what governments have been doing so far without much result is imperative, with a view to giving way to new initiatives that will change the narrative. We must reimagine and root our approaches that has so far defined government interventions over the year. Nigeria and African countries and the global malaria community must also reinvest approaches to address the constraints that prevent efficient delivery of existing effective key malaria control strategies and forthcoming innovations and tools for the country of the disease have evolved both in quality and quantity over the years. Aside from imagining and reinventing approaches to fighting malaria, we must accept the simple fact that malaria is a multi-sectoral problem rather than merely seen as a health issue. As far as the saying goes, prevention is better than cure. In this wise, we must tackle malaria from the very source. Drainages must continue to flow to prevent water from being stagnant, so mosquitoes will take advantage of the stagnant waters. There must be collaboration among the various ministries of health and environment. Contributory factors such as inappropriate dropping of garbage must be checked to prevent blockage of drainages. This implies that environmental laws must be strictly enforced among several factors. It must also dawn on African leaders that malaria is basically an African problem, and research efforts on it must be intensified in the region in the quest to change the narrative. There is nothing wrong in Nigeria taking the lead in this regard, but the government must be ready to fund the efforts. The government must be ready to intensify enlightenment programs on prevention rather than cure of the disease. Failure to meet the financial stipulations of the Abuja Summit by many countries has to give way to improved funding if Africans are to witness a drastic reduction in deaths caused by malaria. My name is Bayo Olaoye.
You watched a report on malaria done by Bayo Olaoye. That was a very beautiful report talking about the malaria disease. Now, yearly, more than 66 million cases are recorded in Nigeria. And he highlighted something very important in that report, which is prevention. Prevention is key. Talking about prevention, we'll get back now to the discussion on the role of Nigerian diaspora in the health sector. And I still have Dr. Douglas Emeka Okor, who is a consultant neurosurgeon, joining virtually in the discussion. All right, let's link this. You talked about exchange programs. There could be, you said there could be exchange programs, and Nigerian diaspora, particularly medical professionals among them, could help with training of doctors, of health workers in Nigeria. And the same could also happen because you said there have been cases where medical practitioners abroad have had to come to Nigeria to learn some procedures that they don't have taking place there. My question is this: why is it that some procedures outside of Nigeria have been stopped, but they still happen here in Nigeria to the extent that doctors who were trained there needed to learn these procedures? Is it a result of some technology, or there are no cases of such where they leave?
I think the last thing you said, Blessing, was spot on. It's just in terms, it's a situation of advancement in technology to actually provide those kind of do those kind of surgeries or do those kind of procedures. But the key thing is that even with technology, you still need the human being. So there are sometimes, for example, in the developed economies where, yes, you do have the technology to actually do a kind of procedure, but sometimes technology can fail, and then you now have to now go back to your basic capacity to actually do a procedure without that kind of technology. I'll give you an example. So in most of the developed economies, they do like what we call most of their gynae surgeries using things like laparoscopes and telescopes and those kind of technology, robots and all that, especially in North America. But those things can actually fail because they're not human beings. And when they fail, you need to actually have the capacity to actually go back to the fundamentals of actually doing the procedure without those technologies. So yeah, it's in Nigeria, because we don't have that level of technology, we are still very good in terms of the skill of actually doing most of these procedures without those technologies. So clearly, when it comes to the issue of that sort of exchange programs where you actually have healthcare professionals coming from outside Nigeria to come and learn stuff in Nigeria, that is a key way. That is something that can happen when you actually have the diaspora getting involved in Nigeria, and when we start transforming the landscape of healthcare in Nigeria to a point where the guys who are training outside Nigeria now say, oh, we can see that Nigeria is doing very well within their healthcare system. Oh, there's lots of stuff for us to actually learn there. But also there's the issue of research and development. Remember, I said that, the Nigerian diaspora is full of knowledge, skill, capacity, and all that. They are full of that, even with respect to research and development. When you look at things, for example, like clinical trials and medical device trials, you see that Nigeria is a very representative population for Black people all over the world. And most of the clinical trials that are done to actually develop drugs, to develop medical devices and stuff, you don't actually have a good representation of Black people in those trials. So you can actually pull in the resources, pull in the grants and funding to actually do most of the things in Nigeria. So you now start having a situation where you're actually producing medication, consumables, making medical devices that will also be representative, that will also make sure that they're also developed for the Black population as well. I'll give an example. That's what they call the pulse oximeter. The pulse oximeter is something you put on your fingers and actually checks the amount of oxygen in your body. During the COVID period, one of the things that they found is that because of the darker skin of the Black person, those pulse oximeters as a medical device wasn't recording as appropriate, as well as it was recording people who are fair-skinned, the Caucasians. Okay, and so they've just commissioned in the UK, for example, some research that they will be looking into how you actually manufacture devices for the Black people and other populations that are not Caucasians and have that kind of color of skin. So very, very importantly, in terms of exchange programs, okay, that will definitely bring FX into the country. It also make as we're transforming the landscape of healthcare in Nigeria, it will also get word outside Nigeria that that these people are not doing very well within their healthcare system. One of the key things is that if you look at the healthcare systems in other countries also have problems as well. In UK, for example, there's what they call the waiting list. If you're waiting to have a surgery, maybe for a hysterectomy or a myomectomy, for a fibroid surgery in the UK. You can wait almost up to 1 year. Okay, so imagine if you now start developing your system in Nigeria to a point where people are now actually confident that, oh, in Nigeria, if you go there within 3 weeks, you can have an operation. You will actually start having effects moving into Nigeria because you're not actually having the provision of such care in Nigeria. You have people coming from US, UK, and other countries to actually have those kind of surgeries. So those are the things that we should be looking at. And we will also all definitely need the Nigerian diaspora to get involved, engage within the process so we can transform the health landscape in Nigeria, because like I said, the Nigerian patients are worth it.
In transforming the healthcare landscape, what is the role of how will public-private partnership help in achieving this?
So in terms of the public sector is going to be very important for actually deploying, let's go to like the tertiary public sector, for example. It's going to be very important in deploying complex care to Nigerians that cannot afford going to the private sector. Okay. Now, presently, we know that the private sector already constitutes the capabilities to actually provide safe and quality complex care at this particular point in Nigeria. And so one of the things that the private sector can bring to bear in the public sector is, number one, the capacity for healthcare management, to actually manage resources. Okay. Number two, training not just in terms of the technical capabilities of healthcare providers, but the non-technical capabilities, what we call the soft skills, leadership, management, communication skills, ability to work in teams and stuff. Those are extremely important. Okay, bring in a training that is competence-based. That's very, very important. Most of the training that we actually do in Nigeria is theory-based, okay? There's what they call application of knowledge, where you actually, it's not just about carrying lots of theory in your head, Blessing, but actually having the capacity to actually translate that theory in your head to actually impact on patient care in real terms. So you can actually have safe and quality care and actually improve the patient journey within our systems. So, and also, of course, the private sector investment in terms of raw cash funding. The private sector can also invest in the public sector in terms of having that sort of financial muscle. So those are some of the ways that we can actually take things forward with public-private collaborations and cooperation.
Let's take a look at the health facilities that we have in Nigeria. So if you look at the public facilities, they are categorized. There's the primary health care centers. There are also the general hospitals, which seem like the secondary healthcare facilities. And then there are tertiary hospitals in Nigeria. Looking at the way these are run and with the intervention of the private sector, where you have private hospitals around, what do you think needs to change in the way these facilities are run to ensure that the healthcare system is standard or standardized? People, when they have certain aim and they know this is just for the primary healthcare, they're there, not crowding maybe the secondary healthcare centers or the tertiary healthcare centers.
So, Blessing, yeah, so Blessing, one of the first things I said was I tried to break the healthcare system into components, isn't it? So now you're actually moving towards the issue of service delivery itself. And one of the things that needs to be done, which sort of on the 12th of December last year, the Universal Health Coverage Day, they sort of laid the foundation. You know that compact that was signed where they talked about the sector-wide approach, okay? The important thing is to integrate our healthcare system, because our healthcare system now is significantly fragmented, okay? Now, one of the key things that needs to happen is that we need to actually build up all these systems properly. The foundation in terms of promotive and preventive healthcare is not there, and that is the basic healthcare system, the primary healthcare system. So we need the federal government, state governments, and local governments to truly work together to build this system. We want a primary healthcare system that is worth its salt and that we can all be proud of. And so what do you need to do at that primary healthcare system? Definitely, you need service delivery, okay? You need to have those primary healthcare centers, okay, that have what it takes to be a primary healthcare center in terms of what the building looks like, power, water, and all that, okay? You need the healthcare workforce, okay? And with the healthcare workforce, you need to look at innovative things, policies like the task shifting and task sharing, okay? We have less than 40,000 doctors in Nigeria. So you cannot actually man all those primary healthcare centers. For if you say the 9,000 wards in Nigeria, for example, that you, at least you want to start with one primary healthcare center in those places. You cannot man all those, you understand, with the amount of doctors that we have. So you now have to think of innovative ways and build the capacity of community health extension workers, pharmacy technicians, medical lab technicians, and stuff like that, and actually make sure that their training is competence-based, okay, and make sure that they are properly regulated, okay, and then you start throwing in digital platforms, okay, emergency record systems that all talk to each other, okay, and then you can start standardizing the referral patterns, okay, and then at that basic level, okay, you now use that for promotive care, where you now actually start pushing out information, especially in local languages, in Pidgin English, to the population within that ward about all the issues of healthcare. For example, you just talked about malaria. Okay, malaria should be a primary healthcare issue. You shouldn't have somebody talking about, oh, the possibility of thinking of malaria, going to a teaching hospital or going to a general hospital. They should be going to the primary healthcare center, but that is totally non-existent. And we are saying that as Nigerians generally, as all the key players in healthcare, they can put pressure, and specifically with what we're talking about today, the diaspora. You remember I talked about interrogating government policy. We want the diaspora groups to be talking. You know, for example, I want to see diaspora groups are coming together and actually having like a press briefings. Talking about some of these issues. I want to see the Medical Association of Nigerians across Great Britain, other groups and associations of other healthcare providers in America, in Canada, and stuff like that. I want to see them on SOUQ News. I want to see them on Arise TV and other media platforms talking about these issues. Interrogating government, putting pressure on government. Nobody does well, Blessing, without pressure. As individuals, as groups, as a community, as states, as country, we must put pressure. And I'm saying that the diaspora, because the government, they don't owe anything. The diaspora doesn't owe anything to go, but the government doesn't owe them something. So they have that power to actually speak to government, talk to government, interrogate them, put pressure on them. In terms of all these policies that can actually integrate our healthcare system, build all these capacities across, but in terms of especially the primary healthcare system, because I'm telling you the truth, within the next couple of years, we need to truly work on our primary healthcare system. And we need to do this and all this because, like I always say, the Nigerian patients are worth a blessing.
Talking about the Nigerian diaspora putting pressure on the government, do you foresee a sort of resistance on the side of government based on a reasoning that the diaspora, those in diaspora, left the country in search of greener pastures? So why are they now putting pressure on government? Like, if there was true love, you would stay back here.
Okay. So the diaspora, first of all, will tell the government that government, we are Nigerians. Government, we make massive remittances to Nigeria. We contribute to the economy in Nigeria. We have families in Nigeria. The Nigerian project is significantly important to us. We are part of Nigeria and we are Nigerians, and you need us as well. I think that is the key thing. Do you understand? The Nigerian government has to know that you need the Nigerian diaspora. Nigeria cannot get to where it needs to be, do you understand, as the seeming giant of Africa, and as that nation that has the capacity to transform and impact and inspire and motivate all Black lives across the world. You cannot actually make it happen in terms of the transformation and the achieving of the goals that we need to do without the Nigerian diaspora. You cannot do it. And we also need to actually look into history. Which of the great countries that you can see in the world today made it without their diaspora? Is it China? Is it India? Even the United Kingdom during the transatlantic slave trade, it was their diaspora that made them actually great and stuff like that. So you cannot transform Nigeria without its diaspora. They are eggheads. They have so much capacity in terms of the skill, the knowledge, and the experience. And Nigeria needs them. And so if the government is trying to push forward a stance that says that, oh, you people left, that's what they call reverse brain drain or brain gain, okay? And I'm an example of that. I trained in the UK. I'm a British citizen, but I'm back in Nigeria, and I've been back in Nigeria for the last 8 years. If you go on YouTube and watch some of the videos of what myself and my team do, most Nigerians will say, wow, you mean this happens in Nigeria? Complex brain and spine surgery, and that is replicated across board in places like Lagos, Owerri, Kano, and Enugu. massive work happening, but mainly in the private sector in terms of complex care that has the underpinnings of safety and quality and delivery at that high level. And so you already have examples on the ground in Nigeria showing that, man, actually giving you real life data, real life examples that shows that, man, you cannot do it at the diaspora. And that is a muscle and the power that the diaspora has. And guess what? Most of your politicians and government officials, when they have healthcare needs, where do they go to? Blessing. They go outside Nigeria, isn't it? They go outside Nigeria, which brings me to another very key important issue that I think the diaspora should also be putting pressure on the government, which is the issue of how do you, what is the, in terms of importance of different cadres of human beings and different workforces in Nigeria, how do you prioritize things? Okay, because one of the things I say is think right, act right, and spend right. One of the fundamental problems we have in Nigeria is how we prioritize things, our conceptualization of things, and the philosophy that guides what we do. If you don't think right, you cannot actually take the right actions, and you won't spend right. Okay, you only deploy your resources, and resources not just money in terms of your time, your capabilities, and your experience and all that. You only deploy to things that you think are important. And one of the things that the diaspora can do is to remind Nigerian governments at all levels that, hey, look at the Sustainable Development Goals. There are 17 of them. Healthcare is number 3. It is significantly important. Number 1 is talking about poverty. Number 2 is talking about hunger. Number 3 is healthcare. In Nigeria now, we're struggling with hunger and poverty. And guess what? Number 3 is actually healthcare. Number 4 is education. It is that important. And so, like I said, the Nigerian patients are worth it. Okay? The Nigerian diaspora must continue to interrogate and put pressure on Nigerian governments. And if Nigerian governments, like you said, want to come up with this stance that, you guys are away from Nigeria, you can tell them, no, look at the issues, all the issues that I've talked about. We have a major stake, and it is in our own interests as Nigerians in diaspora that you actually do the right thing for Nigerians, because you're doing it for us as well. If me as a diaspora, I come into Nigeria to come and visit, and I run into trouble in terms of an emergency healthcare issue, I'm going to be stuck. And so I want the Nigerian healthcare system to improve for my sake as well, because I will visit Nigeria at some point. I have family members in Nigeria. I have friends in Nigeria. Okay, I have investments in Nigeria. Blessing.
All right, now let's look at the issue of brain drain. So Nigerians, many medical practitioners in Nigeria, some of them look to move to other countries to practice for better welfare. Is there any way to manage this, the brain drain in the health sector? Okay,
so again, I was talking about how we prioritize things as a people in Nigeria, okay? The federal government, in connection with the National Assembly, have actually increased the pay of the judicial workforce by 300%, okay? And one of the questions I asked is that most of the guys in National Assembly and most of the federal government, the guys and the politicians are people who actually lead us. When they have healthcare, when they have legal problems, do they go outside Nigeria to actually get their lawyers and seek legal redress and stuff like that? But when they have healthcare issues, they go outside Nigeria, and a significant number of times they will be meeting Nigerian healthcare professionals. Okay, so the question is the healthcare workforce in Nigeria, especially looking at the Sustainable Development Goals and looking where healthcare is in terms of developed economies, where in all the sectors in the country, where do they put healthcare? So are the healthcare workers, are they less important than the judicial workforce? These are key questions in terms of philosophy and how a people look at things that we should be looking at. These are fundamental questions that we must ask. We have to think right, Blessing, so we can act right and deploy our resources right, spend right. Okay? One of the fundamental problems in Nigeria is the way we reason, and our mindsets is a fundamental problem. Until we change the way we think, we won't take the right actions in terms of policies, programs, interventions, and we definitely will not deploy our resources right. And so the pressure must continue. Blessing. The transformation of any sector in Nigeria, especially the healthcare sector, is not a sprint. It's a marathon. And in that marathon, we must make sure that all the key players that need to be getting involved to actually put pressure, to get involved, to participate and contribute that they are doing it. And we must do this because the Nigerian patients are worth it. One of the things I tell anybody that cares to listen, Blessing, is that when I advocate for healthcare in Nigeria, I advocate as a patient, not as a doctor. And I keep reminding people that, hey, healthcare is not about doctors. Healthcare is a system. Healthcare needs every person who is interested in the development of Nigeria to be involved. The Nigerian Bar Association, all the civil society organizations. Please, I'm reminding everybody, healthcare is that important. Of course, what we're talking about today, Blessing, the diaspora, you must contribute, you must engage, you must get involved because it is in your own enlightened interest to actually get involved. And like I said, Blessing, without the Nigerian diaspora, especially the healthcare professionals, you cannot move the needle when it comes to transforming the healthcare landscape in Nigeria. Again, like I said, Blessing, the Nigerian patients are worth it.
As a wrap-up, let's look at the role of the Nigerian patients and the Nigerian government. Now, healthcare is expensive and anywhere in the world, but let's look at who pays for what. Yeah. There is the health insurance scheme in Nigeria. The way it is run, it is contributory. Is the Nigerian government, in your assessment, doing enough with regards to health insurance? Is there a different approach that could bring in more people and perhaps make it more effective to reduce the rate of people paying out of pocket for healthcare?
I think sometimes when you look at government policies in Nigeria, you tend to want to actually think that, that maybe they seem to be playing to the gallery, okay, and then just doing some things for the press and for the media, okay? Because when you look at some policies, you keep asking, are these policies to actually make life better and impact in a large number of Nigerians, or are they just policies just to actually tick the box and say, oh yes, we have this policy, okay? For example, we have 3 levels of care, like we talked about. Primary level care, okay? I want a situation where we can actually deploy a significant part of our resources in healthcare to primary level care with respect to promotive and preventive care for those, especially those people in the rural areas, those 133 million plus multidimensionally poor people. And what am I trying to say? Apart from the issue of looking at the National Health Insurance Agency Act and National Health Agency Scheme and all the state health insurance schemes and the community health insurance scheme, I want a situation where we actually have some integration and good flow within it. Like we talked about the sector-wide approach, where you actually deploy most of these resources to primary care. Because we want a situation where it's an 86-year-old man in the village, okay, we prevent him from having stroke by making sure that his primary healthcare center works properly and is actually accessing care there and actually preventing managing his hypertension so he doesn't have stroke. Because if that man has stroke in the village, he's not going to be able to actually get the resources to actually get secondary or tertiary care in the intensive care unit to actually manage that stroke. So we should deploy lots of our resources to primary healthcare. What I'm trying to say is that the insurance scheme should be tailored more to our basic healthcare. We shouldn't, you see sometimes people say, oh, we need to actually get insurance cover for cancer. We need to get it for complex care and stuff like that. No, you've not satisfied the basics first. Do you understand? You build up, you create a foundation, make sure you solidify that foundation, and then build on it. But I seem to see policies that are rushing to do the big things when you've not sorted out the foundational things. Okay? So what my key take in terms of the health insurance scheme within the Nigerian space is that, can we please organize this in such a way, okay, that you definitely pull in more people and actually deploy those resources for our primary health care so we can have promotive and preventive care for a larger number of Nigerians, these 133 multidimensionally poor people. And then you can start seeing the significant impact within the healthcare system. Blessing.
Many thanks, Dr. Douglas Emeka Okor, Consultant Neurosurgeon, for being a guest on the show today. We do hope that the appropriate quarters would heed some of the advice recommendations that you've made and improve the healthcare sector. And those in the diaspora will have a heart large enough to think about the Nigerian health sector and heed the call when they get it.
Thank you.
So much have been discussed on the show today, from the Future Investment Initiative Summit ongoing in Saudi Arabia to improving the health sector in Nigeria with the contribution of the Nigerian diaspora, with the hope that everyone who needs to do their job, by everyone, you and I, government, and those in charge of the various sectors, the health sector, the Minister of Health, will sit and look at how to improve the health sector for the business climate in Nigeria. Well, it rests on government, it rests on industry leaders, and as well as you and I to do our bit to ensure that it gets better. That's been the show today. Thank you for watching. You can visit social media platforms to leave a comment. Let us know what are your thoughts on the issues discussed today. The handle is at SOUQ News TV. I am Blessing Eichie. The show returns tomorrow, 8 a.m. West African time. Enjoy your day.
Early exchange, shaping policy, advancing development.